so I'm going to go ahead and demo the cardiac assessment. So this is your pre-assessment that you'll come in and do, and you'll be doing this on a mannequin. So when you first start, you're going to ask your subjective questions. So do you have any history of cardiac disease or heart troubles? The patient says no. Do you have any chest pain? Nope. Any shortness of breath? No. And how many pillows do you sleep on at night? And the patient says 1. Okay, next is I'm going to inspect the neck. So I'm looking for jugular vein distension, or what we call JVD. And we're going to do that while they're sitting up. So I'm just going to sit him up just a little bit more. So the patient is sitting up. We're going to turn their head just a little bit. And again, I'm seeing if they have any jugular vein distension, and they do not. Next, we're going to go ahead and listen to the carotids, and we listen first, and we use the bell of the stethoscope. So I'm going to listen. Okay. And then we will palpate the carotids one at a time. Then we're going to go ahead and palpate the apical impulse. And the apical impulse is like the same area as the mitral valve. So it's on the left side. It's mid-clavicular, so clavicle, so it's mid, and it's at the 5th intercostal space. And it turns out that it's kind of right underneath like the nipple area. So you're just going to point and feel for that. If you're down over here, over here, you know, you're not in the right spot. So right up underneath there. So you would palpate. We're just feeling for the apical impulse. You're not counting a pulse or anything here. Next, we're going to go ahead and listen at the 4 valve spots. First, you need to tell me the landmarks, and then put your stethoscope in the correct spot. So the aortic is on the right side. It's right of the sternal border, and it's in the 2nd intercostal space, so that's aortic. Pulmonic is the 2nd intercostal space, left of the sternal border, so this is pulmonic. Tricuspid is the 4th or 5th intercostal space, left of the sternal border. So as you come down, as it kind of starts to dip down, this is our tricuspid. And then our mitral is the 5th intercostal space, left mid-clavicular, so again, kind of right at the right underneath the nipple. So once you've identified them, you're then going to listen. All right. So we have aortic, pulmonic, tricuspid, and mitral. There you go.